This recording will cover the first part of Chapter 44 in terms of medications used to treat eye disorders. Drugs used in the eyes are commonly known as ocular or ophthalmic drugs. Diagnostic stains are frequently used to locate extraocular lesions or foreign objects, evaluate dry eyes, or evaluate extraocular changes. You may have received an ocular diagnostic stain during an eye examination where the eye doctor puts usually it's a bright green, yellow sort of dye in your eye so they can better evaluate your eye. This dye, the coloring of it will go away with time, but we want to let the patient know that they can stain nasal secretions if the lacrimal ducts or the tear ducts are patent, and they can discolor soft contact lenses. So we want to make sure contact lenses are out before any diagnostic stains are used. Contact lenses can be replaced 1 hour after the stain has been applied. So there's a 1 hour wait period before putting contact lenses back in if a diagnostic stain was used. For testing purposes, you want to recognize fluorescein sodium as a diagnostic stain. You see fluorescein, you might think of fluorescent, sort of that bright yellow-green fluorescent color. And there's a quick, less than a minute YouTube video that shows an individual undergoing an examination with a diagnostic stain that you can view on your own. Ophthalmic anesthetics act by locally blocking the pain signals at the eye's nerve endings. So these topical ocular anesthetics are applied directly to the eye. So they don't provide any pain relief if you're having a headache or any other pain throughout the body. They're a local pain reliever. The two most common topical ophthalmic anesthetics are proparacaine and tetracaine. And you notice that C-A-I-N-E, the cane, is your clue that you're dealing with a topical anesthetic. If you think back when we learned about lidocaine, which is a local anesthetic that might be used prior to administering sutures or stitches. So this ocular anesthetic, commonly used, they still end in that C-A-I-N-E, which is your clue that we're dealing with a local anesthetic. Let's see, corneal anesthesia usually starts occurring within 15 seconds and lasts about 15 minutes. The blink reflex is temporarily lost. The corneal epithelium may become dry. We want to make sure that the patient's eye stays safe when that blink reflex is gone and they lose the sensation of pain. So we want to make sure that the patient doesn't rub their eyes or that they keep it safe from anything getting into the eye that could irritate the eye, but they don't have that pain sensation to notify them that something's wrong. Let's see, contact lenses may be reinserted after the anesthetic has completely worn off, usually after 20 minutes. Antiinfectives are used for eye infections, and your textbook provides a list there of different types of eye infections. Conjunctivitis is an inflammation of the membrane or conjunctiva covering the eye and the inner eyelids, and it is the most common eye condition. So just looking at that picture, most of you are able to recognize that by its layperson's term of pink eye, is conjunctivitis. Blepharitis is an infection of the margins of the eyelid. Chalazion is an infection of the glands of the eyelid that can produce a cyst, which cause a blockage of the ducts. Endophthalmitis is infection and inflammation of structures of the inner eye. Hordeolum is an infection, a local infection of eyelash follicles and glands on the lid margins, and this condition is commonly known as a stye. Infectious keratitis is corneal infection and inflammation. And finally, infectious uveitis is infection of the vascular layer of the eye. The ophthalmic anti-infectives are found on page 638. I want you to be familiar with the antibiotics and antifungals that are listed here, but the antibiotics that we've already covered. So Cipro, you want to review and know the classification. that it's a fluoroquinolone. Gentamicin, right? So just give yourself a quick review of these antibiotics. It's an aminoglycoside. Look it up and review some general information about it. Notice a couple of things on that table. So first, the GTT, if you haven't seen that abbreviation yet, that stands for drops. So for instance, under gentamicin, 1 to 2 GTTQ4H, that means 1 to 2 drops every 4 hours. May increase to 2 GTTQ1H, may increase to 2 drops every 1 hour for severe infections. So again, recognize those antibiotics that you've already been required to learn. When you see those endings and those prefixes and those suffixes, those are clues to you as to what type of antibiotic you're dealing with, or that you're dealing with an antibiotic. So if you see something beginning in sulfa, right, you know that it's a sulfa antibiotic. In terms of antifungals, so just like when we learned about antibiotics and antifungals, the medication given is specific for whatever is causing the problem. So an antibiotic won't work if the problem has an eye infection that's caused by a fungus. The antifungal ocular medication I want you to know is natamycin, and then the antiviral I want you to be familiar with is trifluridine. So now we're going to move on to anti-inflammatories and anti-allergy medications. So there's different types of anti-inflammatories we'll talk about. First, here's a term that you need to be familiar with, xerophthalmia. When you see that XERO, you're going to see that again in other lectures regarding different conditions. XERO, you should think dry. So xerophthalmia means dry eyes. And just like with any condition in the body, depending on what's causing the dry eyes, will change how the provider is treating it. So with the specific type of dry eye condition, keratoconjunctiva sicca, this is caused by, it's a condition that causes dry eyes because the lymphocytes damage the lacrimal gland, resulting in fibrosis and loss of tear production. Okay, so the lymphocytes, the patient's own white blood cells, are affecting the glands that produce tears, losing to lack or loss of tear production, and xerophthalmia, or dry eyes. Since this condition is caused by the body's own white blood cells, the treatment is an immunosuppressant, right? If my white blood cells are attacking my lacrimal gland, a treatment could be to stop the white blood cells from attacking that gland, thus improving the patient's dry eyes. So cyclosporine is an immunosuppressant that causes apoptosis of lymphocytes, or death of those white blood cells that are over attacking that lacrimal gland, and allows tear production to resume. So another category of anti-inflammatories is NSAIDs, and we've talked about NSAIDs before. They work by preventing the formation of ocular prostaglandins. Most of these drugs are used for management or prevention of ocular inflammation before and following eye surgery. Unlike corticosteroids, NSAIDs do not affect intraocular pressure, or IOP. However, ocular NSAIDs can increase bleeding tendencies and delay corneal healing. Topical NSAIDs are not expected to increase cardiovascular risk, hepatic reactions, or other systemic adverse effects. However, ocular NSAIDs can cause bleeding of the ocular tissues. The two ophthalmic NSAIDs that you need to be familiar with are diclofenac and ketorolac. Another category of anti-inflammatories you need to be familiar with are corticosteroids. Again, not the first time you've heard about these. We recognize these corticosteroids because of their endings sone and solone. Dexamethasone and prednisolone are the two that you're required to know for this chapter. Corticosteroids can mask infections and delay healing, and are contraindicated in people with untreated ocular infections. Also, it's very important to remember that corticosteroids can worsen glaucoma by reducing the outflow of aqueous humor and increasing intraocular pressure. When allergies are the cause of eye inflammation, Ophthalmic allergy drugs are commonly prescribed to treat the underlying cause. These drugs can contain antihistamines and mast cell stabilizers. Azelastine is an antihistamine. Antihistamines block histamine from activating histamine receptors in the tissue. Cromolyn sodium is a mast cell stabilizer. Degranulation of mast cells release histamine and other inflammatory mediators. Mast cell stabilizers prevent mast cells from degranulating. Ocular sensations that include burning, stinging, and blurred vision are common adverse effects reported. Eye inflammation typically presents with redness due to vascular congestion of the conjunctiva. Ophthalmic decongestants such as phenylephrine, nefazoline, and tetrahydrozoline stimulate alpha adrenergic receptors in the arterioles of the conjunctiva, vasoconstricting or narrowing the blood vessels, thereby decreasing congestion and decreasing the appearance of redness. These are medications like Visine, which is the brand name for tetrahydrozoline, which get the red out, right? So these medications reduce that red eye appearance. Ocular decongestants are contraindicated in patients with angle closure glaucoma because these drugs may contribute to acute angle closure, a medical emergency. Eye lubricants moisten eyes to alleviate discomfort such as burning and irritation associated with xerophthalmia. Again, xerophthalmia is dry eyes. That X-E-R-O you should associate with dry. They are also used to moisten contact lenses and artificial eyes. During anesthesia, when a patient is unconscious or has decreased blinking due to some CNS disorder, lubricants keep eyes moist and maintain the integrity of the epithelial surface of the eye. Many brands and forms of ocular lubricants, also known as artificial tears, are available over the counter without prescription.